Welcome to Coffee with Kyle number 5. I'm Kyle Ridgway. Good morning. Today I was thinking just a little bit about a very deep topic, so we're obviously not going to be able to cover nearly the nuance or the depth that's required to parse this out, but I was thinking a little bit about the application of clinical research, or any research really, or scientific knowledge to clinical practice. And the way that I conceptualize this generally to illustrate that it is a difficult bridge or a difficult step is that what you're essentially doing is taking population means or population data that's been aggregated and analyzed, and you're trying to apply that to an individual. And what I think is important when we do this is to understand the role that research serves and what we're doing in clinical practice. So I think as a clinician, research can be frustrating because what you want is a pragmatic study or a pragmatic trial or a pragmatic line of research that almost kind of tells you what to do a little bit. I mean, I think that's the sense that I get of what I desire. But really, research is set up to answer specific questions or specific questions. And therefore, if you're going to try to induce a lot of control on the situation, on the study, this is why we have controlled trials, in order to elucidate the variables at play and the potential causal links and associations. So you actually want a lot of control, you want a lot of rigor, you want it to be very, very rigid. That's actually important. And basically what you're doing is you're looking at populations or trends within populations. And because of that, you can drill down and answer very, very specific mechanistic or efficacy or effectiveness questions. But we all know that clinical practice is messy. So again, if we think of a bridge concept of how do we bridge this over into clinical practice, we have to understand that in a clinical practice standpoint, we actually have to aggregate quite a lot of research even to just understand the 30,000-foot view of a certain condition or a certain population or a certain complaint or the mechanisms of a certain treatment or the physiology of a certain diagnosis or issue. And then we have to drill down and we have to actually apply this to an individual who we are treating or who is sitting in front of us. And admittedly, this is no easy task. I would say this is remarkably complicated and remarkably complex. I think we actually, both as clinicians and researchers, underestimate how complicated this is. And that means that we actually have to drill in and collect data at the individual level. We have to understand the variables at play for the individual we are treating, and then back assess the research that applies to this person to understand where they fit within this research rather. And then we can come up with ideas on how they may respond to treatment, what the best treatment course is, prognosis, factors that may affect their response to treatment in a positive way or a negative way. And we have to cohese all of this information, and we have to do it dynamically because the person's prognosis may change over time, or their interaction to an intervention may change over time, and the response may change over time. And I think it's really important to understand two separate concepts here. One is that research is designed to answer very, very specific questions, and therefore as an expert master clinician, part of that role or part of that skill set is the ability to not just read research, but to aggregate it and then filter it and apply it to the populations, but really the individuals that you see. And that is a remarkably hard skill, I feel like, that is under-discussed and under-taught of how do you do that, not how do you generally read research and interpret it and critique it and understand its strengths and weaknesses, understand what it can and cannot tell you, but actually drilling in on how do you then apply it to this very specific individual in front of you who has all kinds of psychosocial, economic factors, pragmatic factors, personal factors, previous medical history, psychological issues, all of these things that go into actually determining what to do and how the patient is going to respond. So I'll leave you guys with that today to kind of think on. It was good to see you, and have a great day.